Did you know that lung cancer causes more deaths than the next three most common cancers combined? Over 159,000 Americans are expected to die from lung cancer in 2014, accounting for approximately 27% of all cancer deaths. These numbers include both smokers and non-smokers. For smokers, the risk, of course, is much higher. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. We begin our discussion about lung cancer with Dr. Luis Herrera, a thoracic surgeon with the UF Health Cancer Center at Orlando Health. Now, Dr. Herrera was here in 2008 talking with us about lung cancer, so we decided to have him back to share with us any updates relating to lung cancer and how it's being treated. Welcome back, Dr. Herrera.
Thank you, Nita. Pleasure to be here.
Thoracic surgeon, first of all. I've heard the term, but exactly what part of the body is that?
So a thoracic surgeon focuses on surgery of the chest, and essentially you may have heard cardiothoracic surgeon or cardiac surgeon. So essentially I'm a cardiothoracic surgeon, so I do heart and lung surgery was my training. A thoracic surgeon like myself doesn't do hearts anymore and focuses on all surgery of the chest, excluding the heart.
Okay.
To put more focus on oncology or cancer surgery of the chest.
So let's talk about probably the best known cancer in the chest area, which is lung cancer.
Correct.
Is all lung cancer the same?
It's not. It depends on the type of lung cancer. The two big groups of lung cancer, you may have heard of small cell lung cancer, which is about 20% of all lung cancers, and then non-small cell lung cancer, which is about 80% of lung cancer.
What's the difference?
The difference is the cell type under the microscope, but also the behavior. So small cell lung cancer is a bit more aggressive, can spread more readily, not to make the non-small cell sound like as a benign tumor. They're both very aggressive, but because of the behavior is different, the treatment is also different.
Now, you were here in 2008. I'm sure there have been some big changes since then. What has been the thing that you're most excited about?
So the main changes that have occurred since then have been on the surgical side, more use of robotic surgery to do less invasive approaches for lung cancer, and that has been successful in gaining a lot of momentum. On the medical oncology or the chemotherapy side of things, more targeted treatment, which means doing a genetic profiling of the tumors and targeting specific areas of the cancer cell with less side effects. And on the radiation side of things, more, again, you'll hear this word targeted, where we're trying to focus the treatment, less damage to the surrounding tissue, and so forth. So those are the main advances that are going on in the three fields.
Now, you said genetic. Is lung cancer hereditary? We usually hear about it in terms of being caused by something outside, typically smoking, and secondhand smoke for people who don't smoke.
Correct.
Is there a genetic component?
There's some genetic component for sure, not as much hereditary, but certainly patients with a family history of lung cancer have a slightly increased risk. But it's not as powerful as breast cancer, for example. Certainly the most common contributor is smoking. 80% of lung cancers occur in smokers. Essentially 100% of small cell lung cancer occurs in smokers.
100%?
Of small cell, yeah. To have a small cell, you have to be a smoker.
Okay.
So that means that 20% of people who have lung cancer have never smoked. Women in particular, Asians, non-smokers, tend to have a type of cancer called an adenocarcinoma. And the risk factors for that could be some familiar component, but also genetic mutations where, and these are not passed from generation to generation, but are acquired. We still don't understand why, some environmental factors, but there are certain genes can get altered or mutated and spike the development of lung cancers in non-smokers or never smokers.
And we don't know why that happens.
We still don't know why that happens. There's some theories, but certainly some environmental or gene repair defect where the cells can turn abnormal.
So how do you detect it? You know, for people who are listening who want to know, well, how do I get screened? What are the symptoms? When should I get worried? What would you tell people?
So essentially, there's three ways of finding a lung cancer. One common way is incidentally, where a patient may get an X-ray as a routine physical or in preparation for a procedure, and they detect an abnormality. That's one way, and those patients usually do not have symptoms. The second way is for the patient to have symptoms, most commonly a cough that won't go away, shortness of breath, chest pain, coughing of blood. And sometimes those symptoms can mimic a pneumonia. And you have seen patients treated with a pneumonia and so forth, but the key is that the symptom does not go away.
It doesn't go away, it doesn't get better.
You get antibiotics, you get a follow-up x-rays, and there's still an abnormality in your lung despite your antibiotics, and your symptoms persist. That's a red flag that you have to get checked, especially if you have a smoking history.
Okay.
And the third way of detecting lung cancer is screening, especially screening with low-dose CT scans, which means enrolling patients who are a higher risk, meaning heavy smokers or past smokers, in a screening program that's focused on detection of lung cancer.
So how do you know which one you should do?
Well, essentially, if you have no symptoms and you're a high-risk person for lung cancer, which means to be eligible for screening, you have to have a 30-pack year history, which means a pack a year for 30 years.
A pack a day.
A pack a day for 30 years.
For 30 years, okay.
Right? Or 2 packs a day for 15 years. So an equivalent of a 30-pack year. That's how we calculate it. And be a current smoker or have quit within the last no more than 15 years ago. So basically, if you were a heavy smoker and you quit 5 years ago, you may be eligible for a lung cancer screening.
Okay. So what excites you now about what's on the horizon in terms of lung cancer research?
The most exciting thing is, I think, the genetic aspect of it, or the genetic tumor profiling, because we know that there are 3 or 4 genes that are altered in some lung cancers, especially in never smokers. And those patients, when we detect that mutation or genetic problem, respond much better to treatment, specifically what we call targeted chemotherapy, which is oftentimes an oral agent. It doesn't require intravenous chemotherapy. So this is a pill that is taken every day. And you can see dramatic decreases in many patients who have this mutation. So from a prognostic standpoint, it's a better prognosis to have a mutation. Number 2, it opens the doors for different chemotherapy regimens that are often associated with less side effects. So this is only the beginning. As we study more and more, we're going to detect more genetic abnormalities that we can actually figure out ways to target and
so you're
to treat.
Really getting down to the micro level instead of this big 30,000-foot view.
Correct.
Approach.
I mean, I think in the past, treatment was, well, you have small cell or non-small cell lung cancer, and all non-small cell lung cancer got the same chemotherapy regimen. Now it's a more tailored, individualized approach. So 2 patients may have non-small cell lung cancers, but they may be different cell types, or they may be different mutation profiles, and the chemotherapy for one could be completely different than the other patient.
And I would imagine that impacts recovery time as well.
That, side effects, because you're targeting only one mutation, and the cancer cell is the one that has that mutation, the side effects are less onerous. But also there's been incredible progress in chemotherapy or treatment for patients who don't have a mutation. You know, with more powerful regimens, they're still minimizing the side effects of standard chemotherapy. So standard chemotherapy can be very well tolerated, and it's not that it's, I don't want to put a very negative spin on that.
So I guess the best advice is if you think you may be at risk, ask your doctor.
Correct.
Don't just assume it's a cough and it'll go away.
Correct. If symptoms do not go away, certainly ask your doctor. And if you've had a significant smoking history of, like we talked about, a pack a day for 30 years or more, contact your doctor and see if you're a candidate for a lung cancer CT screening.
Okay. Dr. Herrera, thank you for coming back and giving us an update. That's good news on all of the research that's being done. When we come back, we will meet a woman who is a survivor of lung cancer, and we'll find out the way she discovered it. It might surprise you. Don't go away. Rowena Campbell is one of Dr. Herrera's patients, and she's here to share her story, and it is quite unusual. So, Rowena, first, thank you for being here, and congratulations on being a cancer survivor. There was nothing in your family history that would have indicated cancer. Murray?
You're right.
Nobody smoked?
Nobody smoked.
You didn't smoke?
I didn't smoke, and what a surprise. That's really a big surprise.
So the way your cancer was discovered was quite unusual. Tell us about that.
I was getting ready to retire, and I wanted to make sure I covered everything before I retired. And I had a little small cough and I have allergies. So when I went to my general practitioner, he told me, he said, it's allergies, but I know because, you know, it's a little rough cough. He said, he's just going to give you an antibiotic, but if you want to go to him, I'll send you to him. But he says, let me check your thyroid as well. So he sent me to the doctor for the thyroid, the specialist, and then he sent me to the ear, nose, and throat guy. And of course, he said it's just allergies. And he gave me a prescription for antibiotics, and it worked. And
but did the cough go? Did it work for a little while and then it came back?
The cough went away, and it really didn't come back. And and I guess that's what. Well, I guess I was a little dishonest. The cough went away. But you know, when you get a prescription filled for antibiotics, you know, you need them for colds and everything sometimes, and they only give you 7 days, and then that's it. So I called my doctor and said that I need, that I think that my cough is still here a little. Can I have another prescription? Can you call it in for me?
A just in case prescription.
Just in case. But that's what it was, a just in case.
But you know what? That ended up being one of the luckiest days of your life.
It really was.
Because then they called you back in because he wouldn't give you the prescription without seeing you. And then what happened? And
of course he told me that, you know, that there's nothing wrong. And of course I knew that. But he told me, you know, I see a little swelling on the side of your neck. So just to make sure nothing's going on, why don't I send you in and have a CAT scan done of your throat?
And that's when they found it.
And that's when they found it. Before the day was over, they called me back and said, Ms. Campbell, please come back. We think we see something in your lungs.
So how advanced or how early was your cancer?
It was real early. I think the oncologist had said to me they don't want it anything in your lungs. They don't want it any larger than like 2.0, real small. And he says it's about just 2.5. But so don't worry about it. Don't worry about it. They really still didn't think it was anything.
When did they know for sure?
When they took the PET scan, and when we did the PET scan, he says that the PET scan will tell us whether it's active, whether it's growing or anything.
And it was.
And it was
Very aggressive.
And said it was aggressive. So he says that it's even before the biopsy, he says that I'm 99.9% sure that it's cancer and it's aggressive.
That had to blow your mind, especially with no family history, no symptoms to speak of.
Oh, it really did. I really didn't want to believe him, and of course I called my sister, and I said, they say they see something in my lungs, and it was hard to believe. It really was hard to believe.
So what was your treatment like? Did you have to go through radiation and chemo and all of that?
So I was fortunate that I just had to. They did the surgery, and of course, they took out a section of my lungs, and then the doctor said he got everything, that they tested, the lymph nodes and all, and so no chemo, no radiation.
So yours was done surgically?
Mine was done surgically.
And that's it?
And that's it.
So how often do you have to go back?
I do go back every 6 months for a CAT scan, and for them to look at, for my lungs and all that. So every 6 months I go in for a CAT scan, and so far so good.
So what would you say to people out there who may have recognized, oh, I have a little cough, but it's nothing?
I would say for me now, I believe in going to the doctor. So if you got a cough or anything that you think's not normal, your body probably is telling you. They always tell us our body's telling us something, and it is. And it doesn't take but a second to go to the doctor because like I said, the doctor told me when I went for my first 6-month checkup, he said had I just came in, it would have been too late.
Wow.
So that's how aggressive the form is I had. So by all means.
So you're a little walking miracle.
Yeah. So
and that quest for more antibiotics just in case actually saved your life.
It saved my life. I didn't get any of my antibiotics.
That's a wonderful story, and we're
yeah.
glad you're still here to tell it.
I am as well.
Thank you for sharing it with us.
Thank you so much. Thank you for having me.
We will be back right after this. Lung cancer, it's one of the most commonly known cancers today, but we've heard from doctors that there is hope on the horizon and that more and more treatments are being focused on the cells themselves, preserving healthy tissue. That's good news. But the best news is taking charge of your own health and telling your doctor about any symptoms that are a little out of the ordinary. There is no dumb question when it comes to your health. Thanks for joining us on this edition of Healthy Connections. I'm Annetta Wilson. We'll see you next time.